afternoon. It is your girl Natasha Joseph, aka Miller, again on the channel. Guys, I'm just gonna ask you to just subscribe, hit that notification bell, and like all the videos. This afternoon, I'm gonna teach you. It's all about dental education, dental hygiene, oral hygiene. How can you practice good oral hygiene? To prevent all the gum disease, everything that is bad that will occur in your mouth. Okay, guys, so I just want to first introduce you to my little friend here. It's a model of the mouth. As you can see, you have the top here, which is the upper jaw, and you have the lower jaw here, showing you all the features of the mouth, except there is not a tongue. Okay, but you know that the tongue is right in the middle section here. Okay, first and foremost, I just want to inform you that the mouth is a good indicator of occurrences of what is happening in the body. If you want to know what is happening in your body, there's always a sign, an indication in the mouth. So the mouth is a good indicator of what is ever is happening in your body, whatever sickness, whatever virus, whatever disease that may be in your body. The mouth can be a good indication of whatever is happening in your body. First and foremost, I'm going to teach you good oral hygiene. What are the ways of practicing good oral hygiene that you might be able to have a good oral health? First, I just want to show you my toothbrush friend here. You can see it, guys. Okay, first and foremost, the best ideal toothbrush that you're supposed to have and you're supposed to use when you are brushing your teeth is a soft toothbrush. Ensure that the toothbrush bristles are soft. When they are soft, they won't damage the gum. So you want the most ideal toothbrush is a soft toothbrush. So these toothbrush won't damage the gum, it won't cut the gum, it won't bruise the gum at all. Secondly, I advise you that you must brush your teeth twice per day, especially 8 hours after eating a meal. 8 hours after eating a meal. Twice per day, 8 hours after eating a meal. Then I'm going to show you how to brush the teeth properly. Now, dentists, dental hygienists, and dental assistants and dental professionals will teach you that brushing the teeth is very important to prevent plaque, calculus, and gum disease. So you need to know how to brush the teeth very properly. Now I'm going to bring you back to my tooth friend here. Okay, so you see my tooth friend has the upper jaw and the lower jaw. Now a human dentition normally have 32 teeth. Okay, 32 teeth, and every one of these teeth have a function. But before we go into the function of each one of the tooth, I'm going to teach you how can you brush your teeth properly. Now, a lot of persons, they normally get up in the morning. Well, I can admit, before I went to dental school, I did the very same. A lot of persons like to focus on the outer surface of the tooth, because these are the surface where persons normally see when you smile, and you want a beautiful smile, you want to enhance your beauty, so you want a beautiful smile, so you always concentrate on these surfaces that persons are seeing. That is very good. But guys, you have to remember that inside in these surfaces are very important to brush as well, because in the dental profession, in dentistry, we always recognize that persons normally have a lot of issues, especially around here at the back of the mouth. Sorry guys, at the back of the mouth, around here where the molars are, especially on these surfaces, that sometimes persons even find difficulty to reach, having difficulties to reach these surfaces. So we normally see a lot of plaque, a lot of calculus around these areas. Now guys, when you're brushing, ensure that you hold the brush at a 45 degrees angle, okay, to the tooth. So the 45 degrees angle is at this section, and we normally encourage that persons brush in a circular motion. Why you want to brush in a circular motion is that you want to catch all the surfaces of the tooth, because every surfaces of the tooth is a potential is potential for having plaque and calculus. So you want to brush the outer surface and the inner surface. Okay guys, so you brush in a circular motion so that you catch the facial surface, the interproximal surface of the tooth. Okay guys, so we are brushing the facial surface. This is what you call the facial surface. So you're brushing. Now we go inside the tooth, right? So these surfaces are called the lingual surfaces, right? Because it is where the tongue is. Okay guys, so you have to ensure that in these surfaces are brush, right? These are the interproximal surfaces. You have to catch these surfaces, and these are the surfaces that plaque and calculus tends normal to be, because persons forget these surfaces at times when they are brushing, especially when you're on a rush. You always brush the facial and remember these surfaces. Then these surfaces, these are called occlusal surfaces. This is the molar and the premolar surfaces. These are the surfaces that cavities, we normally see cavities, because these are the surfaces that is responsible for chewing the food. So because the molars and the premolars are responsible for chewing the food particles normally lodge in these surfaces. So it's very important that when you're brushing your tooth, that you brush out these surfaces so no food particles is left to combine with the plaque to cause to give you a buildup of calculus. Okay guys, so just ensure that you brush these surfaces of the tooth. Okay, so I'm brushing them there. So every surfaces, and then guys, you have to ensure that you brush your tongue. The tongue is responsible for a lot of bacteria that contributes to bad breath, other words, halitosis. So you have to ensure that when you're brushing, don't forget the tongue. The tongue is very important. My tooth friend here don't have a tongue, but just remember that when you're brushing, you brush the tongue as well. So these are very important. Brushing is very important. It's the primary preventative measure to prevent gum disease, to prevent any problems concerning bad oral hygiene. Okay guys, and I also want to encourage you to floss. Now when you floss, these surfaces that sometimes the toothbrush has a very hard time getting in these surfaces, that's where the flossing come in. The flossing remove any particles that lodge within these surfaces that the toothbrush cannot reach in between the two ears. So it's very important that you use a floss to get out food particles, because you know when you eat sometimes, well, not sometimes, all the time, food particles always get in between these surfaces. So that's why it's important to floss, because the flossing removes food particles from these surfaces, guys. Yes guys, I was saying that it's important, so just remember, it's important to brush these surfaces, the occlusal surfaces that is responsible for chewing, so that you can brush out the food particles that normally lodge in these surfaces, so that you won't have a buildup of plaque and calculus in these surfaces. And as I was saying before, flossing is important. Why? The floss, when you floss, you get these areas in between the tooth that the toothbrush is having, that toothbrush normally has a hard time to reach. so that food particles that is in these surfaces will be removed by the floss that you're using. Okay, guys? Also, remember that your toothbrush, it is ideal that you change your toothbrush every 3 months. Okay, guys? Every 3 months. And also, to prevent gum disease and gingivitis, it's important that you visit the dentist or the dental hygiene every 6 months to get a teeth cleaning. And when you go to the dentist, they're going to either use an instrument like this to clean the tooth or the Cavitron. Okay, whichever. But it's important that you visit the dentist every 6 months to get a checkup and a dental cleaning. That is very important for you to be gum disease free, gingivitis free, periodontal disease free. Okay, guys? Now, let's go back to my tooth friend. As I said, I'm just going to give you some more dental education. So, as I said, that the human dentition has 32 teeth. Now, here on my tooth friend, here in the lower jaw, you have 16 teeth. Okay, guys? And now, around the back here, right here, around the back, the third molar, and another name persons call it the wisdom tooth. Okay, so you have the wisdom tooth, the third molar. Over on this side, you have the second molar and the first molar. These tooth, the molars, are responsible for chewing the food. That's why every time you're chewing, the food always goes to the back of the tooth, here at the back, because the molars are responsible for chewing and grinding. Okay, also the premolar, so you have the second premolar and the first premolar. The premolar also does that chewing and grinding the food. So that's why all the time you're eating, the food always goes to the back around here to be chewed and grind by the molars and the premolars. Then you have here the canine, and the canine is responsible for cutting the food, cutting up the food. Okay, canine. So that's here, and then you have the lateral incisor and the central incisor. Then it's the same here. The central incisor, the lateral incisor, the canine, the first molar, the first premolar, the second premolar, first molar, second molar, and third molar, which is the wisdom tooth. So at this lower jaw, you have 16 teeth. Okay? So you have 6 molars, 4 premolars, 2 canines, 2 lateral incisors, and 2 central incisors. That comprise of 16 teeth. Okay, a lot of persons in their lifetime, a lot of persons, the wisdom tooth may grow differently in others, because there are some reasons. A lot of persons, sometimes it have to do with nutrition, your age. Try to eat a lot of stuff with calcium and those stuff that will help your dentition, your bones, which will, in other words, help you, to get your molars, your wisdom tooth. Okay, guys? So it's very important. Try to drink a lot of water. Water also helps to wash out a lot of debris from out of your mouth. That is very important. Water is very important. And the same thing goes to our the same thing that is on the lower jaw is also on the upper jaw. So you have the wisdom tooth, which is the third molar, the second molar, the first molar, the second premolar, the first premolar, the canine, the lateral incisor, the central incisor. So it's on this side as well. Okay, guys? So we are learning some information about the tooth. It's all about dental education. Okay, guys, another thing I want to talk to you about, gingivitis. You know, as a dental professional, I have a lot of friends, a lot of persons who come up to me and, you know, complain of certain things that is happening in the mouth. They don't know what it is. So I'm just going to tell you some signs of gingivitis. And right after I finish talk about gingivitis, you can just check out the video. There will be a picture of a tooth, of a mouth with gingivitis and what gingivitis actually. So gingivitis is the inflammation of the gum. So it is when the gum is inflamed that is called gingivitis, and it is normally caused by a build-up of the of plaque and calculus. So that's why you have to brush and practice proper oral hygiene so that you can prevent, which is the main preventative measure for gingivitis, and also visiting the dentist and the dental hygienist every 6 months to get a dental cleaning is very important to prevent gingivitis. Now, some of the signs of gingivitis is is normally a red, swollen gums, bleeding gums. Sometimes you go to the bathroom, you don't even brush your teeth yet. You go and wash out your mouth. You just see your mouth bleeding unexplainably. You don't. There's no. You just bleeding like that. That's a sign of gingivitis. That's a sign that the gums are inflamed. So you have to be very careful, guys. You know, don't disregard, neglect your teeth. Remember, a beautiful smile is very important. Okay, we need beautiful smile, and the mouth, the teeth enhance that smile. Okay, guys. So gingivitis is the inflammation of the gingiva that occurs because of a buildup of plaque and calculus in the mouth. Okay, so the different, there are different ways. Okay, guys, so some of the common causes for gingivitis: smoking. Smoking is one of the common culprit for gingivitis. So guys, try not to smoke. Smoking is bad for your health. It even said on a cigarette. So smoking is one of the common cause for gingivitis. Poor oral hygiene. So when you don't brush properly, when you don't visit the dentist regularly, there's a chance that you can get gingivitis. Also, um, hormonal changes. Certain hormonal changes can contribute to gingivitis. No, you know you have a lot of ladies when they are pregnant, because you have pregnancy gingivitis because of the different hormonal changes in their body. It gives that increased sensitivity in the gums that will cause inflammation. Puberty, menopause, all of those conditions that are caused by hormonal changes can also cause cause gingivitis, gum inflammation. Also, different medications, certain medications that persons might take during some illness or something that they're experiencing in their body can also contribute to gingivitis. Even sometimes when you read some of the medications that you get from the doctor, from the pharmacist, you see some of the side effects. Some of those side effects, gingivitis can also is also one of some of those side effects with some medication, not all, some medications. So it's very important that you read the medications that you're taking to see if gingivitis is one of the side effects. Poor nutrition. So when you are deprived of certain nutrients in your body, that can also cause you to get gingivitis. As I expound earlier, that is important that you get in a lot of calcium, the different nutrients. Try to have a balanced diet, guys. When you have a balanced diet, it's very important for your health and also your oral health. So try to get in the proper nutrients, Eat a lot of fruits, drink a lot of water, and get a balanced diet. So nutrition is very important. Also, stress. When you're stressed, stress can also increase sensitivity and inflammation in the gums, because stress sometimes weaken the immune system, and when the immune system is weakened, your body is not so effective against fighting infection, especially infection that causes gum disease. So try you know try not to be too stressful. Try to relax, guys, because this can also cause gingivitis. Also, persons with underlying condition, especially persons with diabetes mellitus, ensure that you take your insulin on time, because you know diabetes is something that can also cause you to have increased gingivitis. So persons with underlying condition, persons with a family history of having dental diseases, a lot of pre-existing gingivitis, periodontitis. These persons also, as a family trait, can also experience gingivitis on a regular as well. Also, you also, I want to tell you that the difference between gingivitis and periodontal disease. So gingivitis is when the gum is inflamed, and periodontal disease is a progression of gingivitis. So periodontal disease is actual gum disease. Okay, so when the gingivitis is left untreated, it can progress to gum disease. So a lot of persons, they will experience that they're having regression in the gums. They have teeth that are mobile, teeth that are shaky, because the gums, there's a regression in the gums. So guys, just practice your good oral hygiene, so that you might have a beautiful smile, healthy tooth as long as possible. Okay, guys, so these are very, very, very important. So as I said, that the symptoms are red swollen gums, gums that are bleeding excessively. These are some of the signs of gingivitis, and some of the signs of gum disease. Gum tooth that are mobile, easily shaking. Bad breath and a bad taste in your mouth is also a sign that you have gingivitis, you have gum disease. So guys, look out for these different signs, and if you're experiencing these signs, go see the dentist or the dental hygienist, so that you can get your gingivitis cured, so it don't progress to periodontal disease, the gum disease. Okay, guys, and even when it even progresses, still need to see the dentist, so that you can have your gums and your mouth sorted out, and your dental hygiene. Okay, so we're going to talk about common problems in the mouth. So a lot of persons, well, some persons might experience one of the common problems in the mouth: bad breath. The other day I saw something on social media. A guy had on his mask. We have to, the government implement that persons, when they are going out, must wear the mask for safety concerning from the coronavirus. However, there was something on social media. A guy said that when he have on the mask, he never knows that so his mouth smell bad. Now, guys, listen. Oral hygiene is very important. You have to be hygienic in every way. You wash your hands, fine. You have to keep your tooth, your mouth clean and fresh. So one of the main problems is bad breath. Guys, brush your tongue. Your tongue has a lot of bacteria and microorganisms that are normally contributory to having bad breath. So when you're brushing your teeth, ensure that you brush your tongue. And as I said, if you have gingivitis, that is also an indication. Bad breath and a bad taste in your mouth is also an indication. So gingivitis can also, gum disease can also cause you to have a bad smelling breath, and nobody don't want to have a bad smelling breath going outside. We want to have a beautiful smile, a beautiful fragrance all over. Another common problems in the mouth: tooth decay. As I was saying earlier, that we normally see persons with tooth decay That's a black art um, substance that's always in these areas. These areas are called the occlusal surface of the teeth, the tooth, and these surfaces I was saying before is responsible for chewing. So because they are responsible for chewing, a lot of food particles normally lodge in these surfaces. So you have to make sure that you brush out these surfaces. It's very important that the food particles don't stay here. And when they stay here, they form with the plaque, the sugar and the starch and everything from the food form with the plaque that produce acids that normally attack. So the plaque and the food particles combine to form acids that normally attack the tooth enamel. So that's why you're having tooth decay. So guys, it's important that you brush this area. So brushing is the main preventative measures of all of these occurrences. So you brush your tongue, you prevent bad breath. You brush your teeth properly, you prevent tooth decay. Another thing is oral cancer. So guys, in dentistry we are seeing a lot of increases of oral cancer because especially oral cancer normally occurs in persons who are over 40. That is the study area, that persons, that is the study group that normally shows incidence of oral cancer. Now guys, the main culprit and the main causes for oral cancer is smoking. Smoking, especially persons who smoke the chewing cigarette, the e-cigarettes, and so smoking is bad for your overall. So smoking is one of the main reasons why people might catch oral cancer. Also, persons who have the sexually transmitted wards such as the HPV. So that is important that you get your HPV vaccination. So you can cut down your chances of getting oral cancer. Now, oral cancer is one of the second most leading cancer other than the prostate cancer. So guys, you have to be careful. Okay, so if you're smoking, I would encourage you to stop. Even if you smoke marijuana, stop. Smoking is bad for your health. Okay, guys? So if you want to have a good health, smoking. And primary smoke is just as bad as secondary smoke. So if you are smoking and it's catching it, and others are in your environment, it's also bad for them, because study has shown that secondary smoke is more destructive than primary smoke. Alright, so when the persons are inhaling the smoke that you are smoking, it's more even worse. So guys, just keep healthy, keep safe, and stop smoke. Okay, guys. Also, mouth sores. So those are some sores. I'm gonna just gonna see some examples um, on the slide after this. Mouth sores. So they normally stay for no more than 2 weeks, and if they stay for over 2 weeks, there's something you need to be worried. You need to visit the dentist and get that checked out. Okay, guys. Some of the occurrences in the mouth. Some of the normal occurrences in the mouth. So sometimes, so you have normal stuff, meaning that it's not no need to worry. So sometimes you have some bony projection in the mandible and in the upper jaw and the mandible on the floor of the mouth and on the hard palate. Those are called tori. You see it on the slide next. So the mandibular tori, the palatal tori, those are normally a normal occurrence. The Luca edema, normally when persons chewing Luca edema normally occurs in the jaws, in the cheeks here, the cheek area here. Normally when you bite the cheek and stuff, so it's something that will go away, right? So these are normally eerie tongue, fisher's tongue. All of these are normal occurrences in the mouth. Okay, guys, so tune in to my next video. It will be about um, the role, who is an evangelist, the role of an evangelist. I am an evangelist. I'm a master of a lot of trade. I'm a dental professional. I did a master's in public health. I'm an evangelist, and soon to be I'll be a lawyer. So You know, guys, just tune in. I have a lot of things to teach you, a lot of things to learn from my channel. Remember to subscribe, share with your friends and family. Okay, and also my I'll be doing another video is